So I would ask you, what is your advice to kind of a family caregiver? What do you feel like is like the ideal appointment that you have with a new patient or a patient that's considering surgery? What information do you want in that time frame from them?
Well, in the world of joint replacement, I want to know what they've done. Just because you may have severe arthritis and you might have the indication for replacement, there's always room to try other stuff to see what sticks. So you want to know what they've done. I want to know what kind of medications they took for their arthritis, what kind of injections they may have had, what kind of therapy they have. That's the intervention part. And then I also want to know how it affects them. One of the biggest things I see is sometimes patients say, "I'm okay. It doesn't bother me that much." And then the daughter says, "Mom, you won't even go to the grocery store anymore." So having someone there to kind of build the whole picture of how it's affecting their life is really helpful. And yeah, I think the older the patients are, the more they need a little bit of someone to help them navigate, and build the whole picture for the doc.
It's overwhelming. I mean, I've been going with my aunt to just say, I'm going to write down everything the doctor's saying because it's hard to remember all of those things as
It is.
well.
It can be overwhelming. I try to simplify it for the patient and try to put the treatments in buckets. What did you do from a conservative standpoint? What minimal intervention, like injections and those kind of things. And then we talk about surgery. So try not to overwhelm them with all those things. When we schedule a patient for surgery, we also don't flood them with a ton of information early. We say it's like getting on an escalator. Step on, we're the escalator, we'll take it to the end. We'll feed you information as it goes along because it's overwhelming. You'll tell them everything. And a lot of times they only focus like, "Oh crap, I need a surgery," and then they get blindsided, they get like blinders on, nothing else gets in. We're talking about blood clot prevention, infection prevention, and when you need your pre-medical clearance and, oh, you might need this post-op, that just over their head because they're just like, "Oh my God, I need a surgery." You have
Yes.
to be able to feed the information, titrate it in so that sticks.